Welcome to this webcast of the International Dermoscopy Society. We will see together how to manage Spitz nevi. The word of spitzoid lesions, it's really a fascinating word in which dermoscopy has given a great contribution in the definition of features and also in management recommendation. The starburst pattern, even if it's a metaphorical term, it reflects really very well the nature of these lesions, which are so explosive in their type of growing and also in their appearance. So let's start from three cases. Two cases in younger patients, one in a 11-year-old girl, one in a 30-year-old woman, and one in a 57-year-old man. So how to manage these lesions? First of all, why we define spitzoid, a spitzoid lesion, those that we saw before. We have, thanks to dermoscopy, the description of the classic spitzoid pattern. So we define a lesion as spitzoid if it is pigmented, if we find the starburst pattern or either the globular pattern, again in a starburst appearance, in a centrifugal appearance of large brown but also black heavily pigmented globules, and the homogeneous pattern. In non-pigmented lesions we have dotted vessels distributed all over the lesion in a symmetrical way, or the so-called reticular depigmentation, whitish lines in between the vessels or the globules of the lesion. But some Spitz nevi can also present with a multi-component pattern, so a melanoma-like pattern. First case, a 12-year-old girl with a small papule on the leg. In dermoscopy, there is a classical non-pigmented spitzoid pattern. So this is a pinkish papule, and in dermoscopy, we highlight the presence of dotted vessels regularly distributed throughout the lesion. This case is belonging to a young girl who had two Spitz nevi, one on the leg and one on the back. These lesions have a higher prevalence in younger population, and thanks to dermoscopy, but also thanks to many of the dermatologists working in this field, we now know that the natural evolution of spitzoid lesions in children, at least, is through a spontaneous involution, so that during follow-up of this lesion we can assist to a stabilization and then disappearance of the nevus of the dermoscopic pattern, or a simple stabilization, so that in the end of the evolutionary process of the lesions, the lesion is not anymore recognizable as spitzoid in dermoscopy. Given the low incidence rate of melanoma, so the low incidence rate of melanoma in children, we speak about patients below the age of 12 by convention, but in general, before puberty. We consider patients before puberty. One of the recommendations of the International Dermoscopy Society is that in the case of typical spitzoid pattern, either pigmented or non-pigmented, we can do a follow-up of the lesion. So we can follow the patients instead of excising the lesion, because the great majority of these lesions will undergo stabilization or involution over time. But the recommendation is to excise all spitzoid-looking lesions after puberty, because if on one side Spitz nevi can present a multi-component, so a melanoma-like pattern, on the other side, melanomas can present as completely spitzoid-looking lesions, also with regular streaks all over the surrounding the circumference of the lesion, and we also calculated this rate. So the likelihood of finding a melanoma when excising a completely symmetric spitzoid-looking lesion in patients aged 12 years and older It's 13% overall, but this probability increases to 50% or higher after the age of 50 years. And that's why in this 57-year-old man, even if the lesion is spitzoid, from a clinical and dermoscopic point of view, we excised it, and this was a melanoma. The last scenario is that of this 30-year-old woman. We decided to excise the lesion because it was spitzoid looking, because it was a pinkish papule with regularly distributed dotted vessels, so the hallmark of non-pigmented Spitz nevi in dermoscopy, but anyhow we decided to excise it because of the risk of melanoma. This turned out to be an atypical Spitz tumor, which is an intermediate lesion in between Spitz nevus and melanoma. There's not a clear-cut evolutionary pathway in between the three lesions, so the Spitz nevus will probably stay as a Spitz nevus, as a benign lesion all over the entire life of the patient. A Spitz melanoma is melanoma from the beginning. The atypical Spitz tumor reflects our uncertainty, so it's an uncertain, it's a tumor of an uncertain malignant potential, so capable usually of local recurrence, of regional lymph node metastasis, but not capable of distant metastasis. We tried to analyze the phase of atypical Spitz tumors in this study, which was done in 2015, a multi-center study, and we realized that nodularity and ulceration were predictors of AST. Atypical Spitz tumor are usually found in younger patients, about 30 years old, with a multi-component pattern or a non-specific or appearance, or also the typical spitzoid non-pigmented pattern in dermoscopy, meaning a nodular, so a palpable lesion with dotted vessels in dermoscopy. This study, even if it was done in 2015, it's already an old study, because nowadays we have also a new classification of atypical Spitz tumors, so probably many more flat lesions will finally be found in the category of atypical Spitz tumor. But by the way, for sure, we don't miss usually the majority of these lesions, because they in the great majority of cases present with a multi-component pattern or nodular lesions or with ulceration. So in the end, in conclusion, the world of spitzoid lesion is wide and variegated, and spitzoid-looking lesions have to be managed with caution. A conservative management, meaning a follow-up, have been proposed for typical lesions in children before puberty. We excise all spitzoid-looking lesions over 12 years of age. We excise all spitzoid-looking nodules irrespectively of age, because if we have a nodular non-pigmented tumor, spitzoid looking, also the most typical and classical one, can turn out to be an atypical Spitz tumor even in children. So the rule of following the lesions before 12 years of age, it's a rule just for flat or slightly pigmented lesions, but not for nodules. So we excise all spitzoid-looking nodules irrespectively of age. We tried to clarify the clinical and dermoscopic aspect of atypical Spitz tumors. However, keep in mind that unfortunately morphology not always predicts biology in spitzoid tumors. So thanks a lot for your attention.